Good afternoon, and thank you for joining me today. I'd like to acknowledge that we're gathered here today on the traditional territory of Treaty 6, and that the Métis people of Alberta share a special connection to this land. I've watched for several days now as people from all across Alberta have expressed shock and horror at Danielle Smith's open endorsement of Paul Alexander. Mr. Alexander is a conspiracy theorist. He has openly encouraged adults and children to contract the COVID-19 virus. And he labeled the life-saving COVID-19 vaccine as a bioweapon in a recent interview with the discredited conspiracy theorist Alex Jones, and wrote it yesterday in his own Substack. Yet despite this, just last week at a candidate forum held by the Medicine Hat and District Chamber of Commerce, Danielle Smith said she was being advised by a group of doctors about Alberta healthcare, and that those advisors had extended an invitation to Paul Alexander to consult on the future of our system. This is unfathomable. We have the Premier of this province openly endorsing the views and perspectives of someone who does not believe in science. And she's doing this at such a critical time for our healthcare system, which by all accounts, except for those from Danielle Smith, is in total chaos. Danielle Smith previously claimed that staffing shortages in our healthcare system were somewhat manufactured, and she warned of a bumpy road ahead for healthcare in the months to come, completely ignoring the fact that decisions made by members of her own UCP cabinet helped to run our system off the road in the first place. Countless Albertans have no access to a family doctor. Children's hospitals in Calgary and Edmonton are reporting wait times of 12 hours or more. We have seen ambulances lined up more than a dozen deep waiting to transfer patients outside of the Red Deer Hospital. There have been images of people forced to lay on the floor in the emergency room because there are no available hospital beds. And we have emergency rooms in rural Alberta that have been closed for months, and there is seemingly no end in sight. Now, Danielle Smith wants to claim that she's here to save our healthcare system, that she'll reverse these failures of the UCP government. She claims she'll show new respect for healthcare workers. But that is not possible as long as she continues to double down on discredited conspiracy theories and give a platform to individuals who spread misinformation that undermines public health. Albertans deserve better, especially those who are working day and night on the front lines of our hospitals, clinics, and to keep our stretched EMS system running. They deserve a government that will back science, that will truly restore trust and respect with frontline workers, and that will focus on solutions, real solutions, not bogus conspiracy theories. Today, I'm standing here to demand that Danielle Smith do the right thing for Albertans' health care. I'm calling on her to rescind her invitation to Paul Alexander and publicly express that she does not support his harmful views. I'm asking that she release the names of the so-called doctors advising her on our health care, those doctors that thought it was wise to invite Paul Alexander. Albertans deserve to know if there are other conspiracy theorists that have Danielle Smith's ear in this critical moment. And I'm calling for Danielle Smith herself, as the Premier of this province, to use her platform to make a public statement affirming that the COVID-19 vaccine has saved countless Albertans' lives and that it is not, in fact, a bioweapon. Again, this is about backing science and solutions. This is about showing respect for our frontline healthcare workers. This is about ending chaos in our healthcare system. Thank you, and I'm happy to take any questions you might have.
Just a reminder for those on Zoom, it's the raise hand function to get in the question queue, and if you're on the phone, it's *9. We'll go to our first caller. Please state your name and outlet.
I'm just wondering, what do you think is at stake when it comes to choosing these advisors? Are you worried that vaccines aren't going to be available anymore, or like what is the worry here?
My deep concern is for the impact this could have on our public health system and our broader public health in the province of Alberta. Alberta already has one of the lowest rates of vaccination and certainly uptake on booster shots in the country. If the Premier is taking advice from discreditable individuals like Paul Alexander, who spread blatant misinformation and lies about the COVID-19 vaccine, it's unlikely that it may be less likely that Albertans will step up to get those booster shots. It certainly seems less likely that the government will make efforts to boost vaccinations. Indeed, they've already rolled a lot of their efforts back. So my deep concern is that if they are taking this kind of advice, they are also sending a message to the folks who work in our front lines of our healthcare system, that this is not a government that supports science, that this is a government that is going to go to individuals who undermine the work that our frontline healthcare workers do every day, and indeed that will make their work far more difficult, creating even further chaos in the system.
Do you have another question, Catherine?
Yeah, and we're seeing, at least in Edmonton, a very large number of students who are out sick with various illnesses. I'm wondering what, if any, measures should be taken at this point to address that?
So certainly I've been hearing those concerns from many Albertans and have been watching those numbers. Ultimately, these are decisions that need to be made by public health experts without political interference, without politicization. Sadly, that is not what we appear to see with Danielle Smith. We've seen her, unfortunately, in many cases, come out and put out a political position long before public health expertise has had a chance to speak. With her potentially listening to folks like Paul Alexander, that does not bode well for decisions being made in the best interests of Albertans, protecting them and their children. So indeed, we have called for an independent science panel, much as they have in Ontario, publicly known figures who offer advice directly to the government of Ontario, public health experts who believe in the science. So that's really what we should have here in Alberta. Open information and recommendations from real public health experts on what steps we should be taking in these sorts of situations.
Thank you. We'll do one more pass for questions. A reminder, if you're on the Zoom, it's the raise hand function. If you're on the phone, it's *9. Seeing none, that ends our press conference for today. Thank you.
Excellent.
Thank you so much for watching, and to learn more, check out albertasfuture.ca.